Last week, we published on the Journal of Clinical Oncology the results of a long-lasting randomized trial comparing two different chemotherapy regimens in patients with diffuse large B-cell lymphoma, with relapsed or refractory disease, and candidates to high-dose therapy and autologous stem cell transplantation. The study was designed and conducted by the National Cancer Institute of Canada, led by Michael Crump, and some of other in Italy belonging to the former Gruppo Italiano Studio Lymphomi contributed in this trial. The final results of this study showed that the two regimens, the DAP and GDP, had equal activity in achieving a complete remission before high-dose therapy, and were able also to allow the high-dose therapy program to more or less 50% of the patients. However, the GDP regimen resulted better tolerated, with less grade 3 and 4 toxic effects, and patients undergoing this treatment were also treated in an outpatient basis. So the efficacy was similar, but tolerability and also the management of the patients was easier using the GDP. In an editorial signed by Christian Gisselbrecht that has been published on the same issue of Journal of Clinical Oncology, Christian concluded that GDP and DAP have the same anti-lymphoma activity, and also agree that the GDP was more manageable and probably could become the new backbone for future trials. However, the conclusion was that the long-term remission in this group of patients was not enough. So we need absolutely to have new compounds, new drugs to improve the outcome of patients with relapsed or refractory diffuse large B-cell lymphoma. That's all.